Come in.
Hello.
Hi.
Are you Mrs. Sheehy?
Yes,
Hi. Dr. McIntosh, you probably remember me from placing the catheter.
Right, yeah, yep.
How are you doing?
Okay, I noticed that there was like 2 lines coming out though, is that okay?
So I need to talk to you today because we did have a complication with your catheter placement,
Oh, okay.
which I'm very sorry about. I wanted to kind of talk to you about it and tell you everything that happened and figure out a plan from here.
Okay,
So you had your C-section 2 weeks ago.
right.
And then after that, you had a infection in your belly, which kind of walled itself off. And so what we usually do is put the catheter in. So I'm sure all of this is not news to you, as we talked
Right,
about it before.
right, yeah.
So that's why we put the catheter in, is to drain all of that infection and the pus. So as we probably discussed before putting the catheter in, there were some risks that, you know, the placement could not go as planned.
Okay.
And one of those is, it can be difficult to tell sometimes what the structures are, if it's a recently post-operative patient or if there's infection in the abdomen. And so what happened is one of those catheters is actually placed within your bowel.
Okay, so that's not normal.
That's
Okay.
not normal.
All right.
And what we wanted to do was place the catheter in the abscess. And so the first catheter that I placed in the bowel, you know, which was not my intention, but it was difficult to see kind of what structures were which. So when I realized that, I went back and I placed the second catheter, which is located in the abscess. So one of them is probably draining what it should be draining, and the other one is probably contents from your bowel.
All right, so it's draining out of my bowel, so is it draining in, where is it draining to, out of my bowel?
So you have 2 tubes coming out, right?
Right.
And they're both draining?
Okay,
Yeah, so one of them is draining the contents of the abscess, and one of them is taking like bowel fluids and stool and things like that.
okay. So, like, what's this mean? I mean, is I still gonna be able to go to the bathroom, or am I gonna have a bag? What's gonna happen?
So what we'll do is, we'll leave the catheter that's in the abscess, that one's fine, we'll keep an eye on that, see how that's draining. But for the other catheter that's in your bowel, what it means is that there's a hole in your bowel, and that is something that you can't really walk around with.
Right.
So my thought is that you're likely going to need to have surgery to repair this hole in the bowel, because otherwise everything that's going into your digestive system, including like air, food, water, anything that you eat or drink, and it's turning into stool, would be leaking into your abdomen.
Right.
You're already on antibiotics for the infection, so that's hopefully going to cover any additional infection that this can cause when we take it out. But I am afraid to say that I think you need to have surgery.
Oh my goodness. So, like, I mean, how did it happen? I mean, I guess I don't understand, like, how did you know that it happened?
So after I placed the first catheter, the one that's in your bowel, I was in the control room and we were doing the scan, because you know how we do a series of CT scans, just a few images at a time.
Yeah.
You probably don't remember that much of it, but
No.
Another doctor and I were looking at it, and it looked like, you know, we were trying to figure out which anatomy was which, and concerned that it was in the bowel. So we injected a little bit of contrast into it, which showed us that the contrast was going into the bowel and not into the collection where we were hoping the tube was. So that's kind of how we figured it out. And then I left both tubes in because I didn't want to pull that one right out and leave you with a leaking hole in your bowel. So right now it's kind of, the hole that you have is being occupied by that catheter. So
then hopefully it's not leaking.
hopefully it's not leaking.
Oh,
So
man.
we'll probably need to do a little more imaging, you know, when we pull the tube, or they may wait to pull it until you're, you know, in surgery, so that we don't spill anything out into there.
So I was hoping to go home. I mean, I'm kind of really stressed about getting home to the new baby, because I really don't have anybody to help. My husband just started a new job, and my mom and dad are just there temporarily. They can't really take care of an infant much longer. So, I mean, how long am I gonna have to stay here?
I can't give you an answer, I can't, unfortunately. I would like to, and I feel terrible that this happened and that you have a baby waiting at
Right.
home for you, and that you had this complication, that we caused this complication. But we just have to take it one day at a time. I'm gonna have the surgeons come in and talk to you, and I'm gonna consult with them, and we're gonna come up with, a plan for you, and we'll get it done as soon as possible.
Are they coming in today?
Yes.
We will
Yep, we'll get
some
somebody to
answers
come in today, for sure.
Yes, hope my husband is gonna come tonight, so hopefully, he's gotta, we've gotta have a plan tonight, cause I don't know what I'm gonna do. I was just hoping to get off the antibiotics so I could start breastfeeding the baby again, but that's not gonna, I'll be on antibiotics for a long time.
Yeah.
So down the road, is there gonna be any after effects of all this?
So anytime that we puncture the bowel or that you have surgery, there's a risk of having what's called adhesions, which are kind of scars that happen in your belly, which you probably, if you're going to develop them, having a C-section and having the abscess are things that kind of, can also cause adhesions. So with this additional surgery, there's the potential for causing adhesions kind of in a similar fashion. You all are already at risk from having the abdominal surgery, but this certainly is another thing right on top of that.
So what can you do? What's the hospital gonna do to help me? I've gotta find some care for the baby, and what about the cost of another surgery? My insurance gonna cover that?
We will definitely work with you. If you want, we can wait for your husband to come in tonight, and I can come in with the surgeons, as well as I can get somebody from the hospital, from risk management, to kind of come in and just talk about what happened a little bit more and really move forward with creating a plan. And I'm sure that we can help you with assistance for, the cost and for childcare and some support there, because, we feel really bad that, I feel really bad that, I'm contributing to you needing to stay in the hospital longer and needing another surgery. With any procedure, there are risks, and we certainly hope that none of these things happen, but sometimes they do, and I'm really sorry that this happened to you.
All right, so where do we go to from here? So I'll meet with the surgeons tonight?
Yeah, we'll wait for your husband to get here, or anybody else that you want to come.
Okay.
And we'll get together a plan to get this taken care of as soon as possible. And yeah, I'm gonna be here, so if you need anything and I'm not around, you can ask the nurse to page me, and I can be here, or if you think of any questions after I leave. But I'm very sorry that this happened, and I'm sorry that, I was kind of at the head of the procedure when it happened, and I'll do whatever I can to help you with a speedier recovery.
Okay, all right. Okay.
Do you have any other questions for me?
I don't right now. I'm just trying to get my head around all this.
Okay. Is your husband gonna bring the baby in?
I don't know if he's allowed to or not.
Okay. Well, from our end, you can certainly hold her. I know the breastfeeding's off limits now for while you're on the antibiotics, but the infection's inside, and so you don't have to worry about holding her and spending time with her if she's allowed in.
Okay.
So, I'm very sorry.
All right.
Please let me know what I can do.
Okay.
Okay? I'll see you in a little bit, and page me if you need anything.
All right.
Thanks.